what day of the week is it? Is it, I think it's Tuesday. Happy Tuesday. Or is it Monday? Oh my gosh. I have no idea. I have no idea what day of the week it is, or even how long we've been stuck in this house. Dr. Natalia is joining me, and we are going to talk about teenage skin. Is it Tuesday? Thank you very much. I mean, honestly, it doesn't really matter what day of the week it is, does it? Because every day is the same. Except I'm getting to speak to you today. I just thought that I would log on a bit earlier than Dr. Natalia, just to say hello. I chatted with Dr. Samina about pregnancy and April 94th, yeah, that's about right, about pregnancy and corona, etc. And then people started asking me about my hair, which was a little bit awkward because I didn't really feel I could talk to you about a subject that the lovely doctor had come on to talk about. So that is why I didn't respond to your messages about that. Hello, Spain. I want to go to Spain so much. Mimi, that's our next holiday together. We are talking teenage skin today. Needless to say, my skin is not teenage, but I have started making a list of questions. So if any of you have got any questions, hello London, I wish I was there so I could go running. Hello Saudi. Dr. Natalia is currently in London and she has had corona. She actually went back to work yesterday. Somebody messaged me today to ask me about makeup, and I said, really, you need to sort your skin out before you go out and buy more makeup. There's no point in covering up any issues that you have. If you're not happy with your skin, you're not confident, you're probably not happy. So get your skin sorted out before you go and buy makeup and stop covering up any issues that you have. There's no reason, because so many issues can be sorted out. And Dr. Natalia is a magician. She lives in London, but she comes out to Dubai when she's allowed to fly. I have put on weight. I have gone against everything that I stand for during this time, being shut inside. And not being able to run or walk has taken its toll. I am having to be very strict with myself, and I've gone back to my no sugar during the week, which is what I've lived by, but just I have been turned upside down by this whole thing. What? I've got a dog down here walking. I have done my first headstand. My beautiful friend, Phoebe Tomlinson, you should check out her page, a working yoga page, and she does the most phenomenal headstands with her arms out and all sorts of things. Do I read books, and what kind of books? Ooh, do you know what? I'm quite lazy about reading books. I've got a book next to my bed, which I read about 4 pages of yesterday. I'm so tired. Being shut inside seems to make me more tired, and so reading just sends me straight to sleep. So audiobooks, so I'm in the car, I listen to audiobooks, and I really love them. Max, whoever you are, maybe old enough to be your granny, but that's a little bit rude. My hair is grey. I have been letting it go grey. Yes, I do use purple shampoo. I have been grey since my late 20s, and have covered it up, dyed it, and done what the world told me that I should do, and that is not to be grey. But I would not be talking to you now, and I would not have been in British Vogue or started modelling if I was not grey. So for me, it was the best decision I ever made. Do you know what? I couldn't tell you which purple shampoo to use. I haven't found one that I like more than another. My favourite perfume is Portrait of a Lady. So I think that she is here. Fingers crossed. It's work. Shucks. I'm really so. Yay!
Hi, hello. Hello, everyone. Oh, I didn't know I'd seen that. Woo!
How are you?
I'm okay. How are you? Busy morning.
Busy morning. But tell me, how was work yesterday? You're back at work.
Yeah, work was good. Most patients came for their surgery, which is good. Skin cancer does not stop for coronavirus. Yay! So it was good. It was good to be back.
Don't say that.
I know. Actually, that's a horrible thing to say. Yeah, true. Sorry. No, it was good. I had to kind of get used to wearing all the PPE, which is a bit weird. It's like it's hard for me to talk. I talk to patients all the time. And so with all this stuff on, you can't really talk very well. Glasses are steaming. And anyway, it was fine. I got through it in the end. But my hands super dry. So I had to wash my hands about 100 times for each patient.
Okay. Mate, can I just ask, did you have enough of everything you needed?
Yeah, I had enough of everything. Everything was fine. I had a special visor and everything. I'll take a picture tomorrow in my full kit.
Oh, yes, please. Definitely. I want to see that.
Yeah.
Right. We get on to the topic.
What's the topic? Teenage.
Today's topic.
I know the topic.
Teenage. First question is, what age can a teenager start using cream?
Cream as in for just general well-being?
You moisturize a baby maybe, but you don't put cream on its face every day.
No, but most parents do moisturize their babies' faces, I think, from birth onwards. At least I know some people who do that.
Mimi, I'm really sorry, I didn't do that.
You didn't moisturize Mimi's face.
No.
I don't think that there is an age per se that you need to start moisturizing. I think usually teenagers will start moisturizing their face when they start using acne treatment. That makes sense? Because the acne treatment is quite drying. So I think that's when they start to think about using, all these moisturizers and stuff. But I think for the most part, this actually is a good question, Caroline, because the question is here, why do people start using moisturizer as they get older?
My husband does not use moisturizer, and he swears that he doesn't need it. His skin does everything itself. And I've bought him stuff, and he doesn't use it.
Yeah, so the question is that brings the whole when do girls start feeling like they need to use face products and why? So the obvious one is going to be, and we're talking about girls here because girls are different, obviously, from boys. So I think for girls it's going to be acne. They said, but in London you always need to use moisturizer. Actually, our climate is really humid. Like the UK is a maritime climate. It's really, really humid, as opposed to Dubai, where it's actually very dry. You're in a desert, though it's oddly humid sometimes too. But like Dubai is very dry, especially the air conditioning. So I would think that in England, you actually potentially wouldn't need a moisturizer. But anyway, all your husband needs you.
No, she's not my daughter, but she's a lovely friend, and probably I am old enough to be her mother. But my daughter is 23.
She's not old enough to be my mother. My mother is
puberty hits earlier now than it used to.
Yeah.
So are you now seeing girls at a younger age?
Yeah. So, I haven't been a doctor that long, so I haven't been a doctor 40 years. But, I think the youngest child I've ever seen with really severe acne was 7 years old. Yeah, she had she also had a period. Can you imagine being 7 years old and getting your period?
That's tragic.
Horrible. So obviously that was really hard for her, obviously. So we had to treat her like a grown-up, like a teenager, and manage her. But it was really hard because she was only 7. So she didn't want to use cream. You know what I mean? Because I guess also with that, it's like, when are they going to be happy to use, topicals? That's the other thing. Like, when is a child going to be compliant? Because they actually have to put the cream on. So, I think it's a very difficult question. I think every child is going to be different with when they're ready to use topical agents, when they need to use them, if ever, so it's a hard question. So,
but you don't need to be spotty, right? That someone's saying, if we catch acne in our teen early, can we stop it spreading? So if you catch it early, it's pretty obvious if your 7-year-old gets a spot, you're thinking, oh, alarm bells.
Yeah, so if your child is starting to get acne really young or at any age, if you treat it quickly, then yes, you'll stop it from getting worse. Because what we're really trying to do is prevent scarring. So with with teenagers and young children, I just don't want them to have scarring, because scarring is extremely hard to treat. So there is no too young age to start treating acne if your child has acne, if you get what I mean. But I would strongly recommend that you don't go to a beautician or an esthetician. You go to a doctor, because like a dermatologist, in order to treat that. Even just one dermatologist appointment will set you up and make that better, rather than starting to use like over-the-counter stuff and facial. Don't do any of that. Just go do it efficiently. Save yourself the money, the time.
Yeah, I'm also guilty actually of saying you need to go and get a facial, because I'm thinking you need to clean the skin.
Yeah, no, that's a very common like kind of thought. It's not due to external factors in 99% of people, or in almost 100% of people. So it's it's a hormone issue, and so it has to be treated accordingly. So I mean, facials actually, there's good evidence to show us that having a standard facial causes acne. So I would generally never, ever recommend facials to any patient, especially not to acne patients. Like anything where they're doing like the cleansing, then the massage, then the extraction, and then like the mask, that's like a standard facial. That in 33% of patients, that causes acne. And that's a large group of people.
That is. How do you know when your teenager gets spots or acne? Is there a difference?
No, there's no difference. Acne vulgaris is just the scientific term for spots. It's just the word we use. I think what you're asking is like, where's the threshold for treatment? So is couple spots, is that fine? When do you start thinking, oh, this needs to be treated properly? So I think when you start to notice it as a parent, or your child is starting to feel self-conscious, then you probably should start seeking professional treatment. I'm not a fan of masks in general, so I don't think there's anything magical about a clay mask, though that's sold as an acne mask, because it's meant to be like purifying or something. There's meant to be something in clay, which is all rubbish. So I wouldn't really bother. It's not going to do anything. Masks have absolutely no impact on skin in the long run. So they do maybe temporarily make you feel a little bit like your skin is softer or more glowy, but it will last for about 60 minutes. Then it'll go back to normal, because it's just a temporary hydrating effect.
She's saying that her daughter has spots on her forehead. Are there areas for young people to have spots?
Not specifically. With the forehead one, what I always am looking at with children with forehead acne is that there is a thing called acne mechanica, which is not really, it's like mechanical acne, and it's not normal acne. It's usually like a friction-related folliculitis. So when the hair follicle is being disrupted through friction or like pressure. For example, if I see teenage boys who have folliculitis or acne just around their chin, and they, for example, play a sport where they wear a helmet with a chin strap, it's going to be due to irritation of the hair follicle from that chin strap. I've had I had a couple female teenage patients with acne just on their forehead, and that's from irritation from those latex swim caps. That's quite uncommon though, but there are very specific areas where, from rubbing of a helmet or something, where you'll get irritation, or on the back of the neck they get it, specifically from certain things. Yeah. So
does it make a difference?
No, and that's always people like, oh yeah, but it's your oil in the hair. No, the fringes don't matter. It's not from the fringe. Sorry.
So really, she needs to come and see you
or any dermatologist.
Or any dermatologist.
Yes,
yeah, see that lady. Oh no, there was a lady on here who's in London. Can people come and see you in London?
Yeah, but not right now because the clinic's closed. But I'm doing video consults for my London patients. Home skincare for blemishes. What product? Well, there's all those ones you can get, like salicylic acid and stuff. I mean, I like benzoyl peroxide for acne. I think it's quite useful. I like a topical retinoid for acne. But those aren't over the counter. Those are usually prescription. Except in Dubai, actually, you can get it over the counter. I'm talking more like Differin gel. You can buy Differin gel over the counter.
Differin,
yeah, that's for acne specifically.
pores and blackheads in teenagers?
So pores are due to like increased oil secretion in the skin. So that's kind of a genetic thing. It has to do with oiliness of skin. There's not much you can do for enlarged pores besides treat oiliness, but that's not going to necessarily make the pores smaller. Blackheads are clogged pores, and they're pre-acne, they're comedones. So with those, again, you need to kind of deal with the underlying problem, which is the lots of oil secretion. Yeah, there's no easy answer, unfortunately, to that question.
So some people have blackheads and pores, and other people, not very many, but some people have none.
It's going to be mainly genetic and how much oil you produce. So if you have really, really oily skin, you'll have a tendency towards having larger pores and blackheads because of the oiliness kind of causes stuff to stick within the hair follicle. It's not the only reason. So a blackhead's actually quite a complicated little thing, and how it forms isn't just one thing. So it's a combination of having too much oil, but also something wrong with the way the lining of the hair follicle works. So instead of just shedding like it would, like I don't have blackheads, so mine just sheds. But then in some people, that's the lining of the hair follicle is too sticky, and then instead of shedding like normal skin should, they get stuck in there. And if there's lots of oil, the oil sticks in there as well, and then your acne bacteria on the skin, it thrives off eating fatty acids. So then you have all these things happening at once to cause this blackhead to then eventually turn into an acne spot. So you have to look at it from that the physiological kind of way to then target each thing separately. So taking the oiliness away can help, and then changing the way that follicle works helps as well. And that's what retinoids do.
If your child starts to get spots, do they go to a doctor or do they go to a dermatologist?
So I think if you're in the UK, you would go to the GP first, because a GP can start treatment. If it's very mild, the GP can start you on the right kind of topicals and things like that. In like Dubai, again, going to a good family med, like Dr. Sophie can deal with basic acne very well at King's. And then if it gets a little bit more intense and she thinks that a dermatologist is required, then she can refer. So, I work a lot with family medicine, like Dr. Ali as well. We work together. So it depends on kind of who your GP is and then where you are. Not every child needs to see a dermatologist if they have a good GP.
But the earlier you see a dermatologist, then the better odds you have in having better skin later in life.
Yeah, I mean, I think if you have access to a good dermatologist, then I would suggest going there straight away. But it's not like if it's very relatively mild acne, some family medicine doctors like Dr. Ali and Dr. Sophie are more than capable of managing that and knowing when to up. Right. So work together. Yeah.
So retinoids on a 13-year-old?
Totally fine. Yeah, totally fine. Not a problem.
Really?
Yeah, completely. It's made for the different adapalene. These are made for younger people. So yeah, it's totally safe. It's totally fine. You can use a retinoid for acne as well, but it's not specific. It's different. Is meant to be more specific for acne. So it's probably preferable to use the retinoid that's made for acne. But if you can't get that one, then the tretinoin is fine. The different is a lot more expensive.
Another question for you. Is there a way to softly control oil secretion to manage blackheads?
Softly. I guess with a topical, not really. So there isn't any great topical that will reduce oil. Topical retinoids will do it to a point. So adapalene will kind of, but it's not going to be dramatic. I mean, there is no great way to, so the reason why that is because what you want to do to reduce oil secretion is you need to shrink down the sebaceous gland. So the oil gland needs to be shrinking so it produces less oil. And the oil gland is sitting deep in the skin. So in order to penetrate that gland and get it to stop doing so much, that would take a lot of interesting chemistry on the part of a cream, if you get what I mean. So the way that I shrink oil glands, or the way that we do that, is with oral Roaccutane, because that is how it works. And you take it as a tablet and it does it. So putting anything topically on isn't going to do that. I think what people notice when they use drying creams, because like different gel, these are quite drying. That dryness is mistaken for a decrease in oiliness when it's not actually a decrease in oiliness. It just, you've lost hydration in the skin. So in the end, anyway, the answer to the question is not really. There is no good way for oil secretions with a topical. Sorry.
Okay. Then you have mentioned, and I've actually used, those nose strips you can buy?
Yeah.
If you use those, and they're pretty good, I think.
Yeah.
Then what do you do to your skin after you've taken that off?
So I would use the Dapoline on at night to try to maintain that. But those aren't blackheads, those things on the nose, the sebaceous filaments that people call them, those little black dots. Those are little tiny hair follicles that just have little bits of oil in them. They're not the same as blackheads. And they're very on almost everyone's nose. It's just because that's just the way the hair follicle on the nose is. I think the pore strips is just a cosmetic treatment to just remove the little oil. Because when you do it, you see the little yellow.
It's so satisfying.
Yeah, it's very satisfying. So those little yellow plugs, if we call them like little plugs, those are just little oil plugs in the skin. And everyone has them. When I posted that on Instagram, I got so much crap from people. Like, how can a dermatologist be telling people to use pore strips? I'm like, seriously, it doesn't do anything bad to your skin. Like, it's just gonna take out the little, it doesn't take the skin off, it just takes out the little plug, because the little plugs are sitting proud of the skin. And it's a glue, it's like a polymer glue, which then when it dries, it just sticks onto those little proud plugs and just pulls them out. It doesn't, and I couldn't explain that on Instagram because I was like, I can't.
And so, but after I've done that, I'm thinking I need to fill the holes.
Yeah, because you guys are on.
So my go-to for that, which I know you're going to say it's wrong, but my go-to for that would be alcohol. Close those suckers up.
But it doesn't close them, does it? Does it close them?
Well,
no, because you can't close them because they're hair follicles. They're always open because there's a hair sitting there. No, because the thing is, if you do that, then you're causing alcohol. What kind of alcohol are you using? What are you wiping your nose with?
Well, it's not whiskey.
It's vodka. Vodka. It's a beer.
It's medicated. The stuff you buy from the pharmacy, alcohol.
Did you put that on your face? Okay.
Not often since I met you.
Oh, right, good. My God, saved your nose. No, but that's gonna damage the skin on you. I mean, that's really like irritating to the top of your skin. So no, I wouldn't do that. I wouldn't do it. Thing is, like, I wouldn't do anything. Just do the little pore strip and then just leave it.
Right, and no lemon juice. So, gin and lime. No gin and no acid.
You'll just burn your skin. Yeah, no lemon juice. Lemon juice is bad for skin. Burn. Oh, I've never tried lemon juice on my skin. I don't think I'm gonna try.
Different zones for girls and boys.
For acne.
Yes.
Boys tend to get acne everywhere on their faces. And then at least I find. And then girls tend to generally more get acne on their lower face. But with teenagers, it's just very variable. So it can be anywhere. Yeah.
And would you put the same cream on your back if you have a SPAC?
With back acne, you have slightly different kind of hair on your back than you do on your face, so the follicle is different. So I would usually for back acne, I would use the strongest benzoyl peroxide I can use, and that's pretty much it. So I'd use a 5 or 10% benzoyl peroxide gel, which would also bleach sheets. So just FYI. So if you're going to use that, just your sheets will get bleached. But that's what I would use for back because your back skin, your dermis is so thick, the hair is different. It can take it. It can take something much more powerful than your face can without burning and stuff. So yeah.
Right. Benzoyl peroxide, is that something you buy over the counter?
Not in the UK. We can only get 5% benzoyl peroxide gel, and it's a prescription. In Dubai, I'm not sure. I think you can. You can get most things over the counter. I think you can get benzoyl peroxide, but you can order, I think you can order online, like a 5 or 10% benzoyl peroxide but that's not for face. That's definitely for body.
Not a face. Somebody just asked about apple cider vinegar. I used that for quite a long time as a toner.
Okay, I don't know anything about it, so I have no idea. As a toner, I don't think there's any harm in using apple cider vinegar as a toner. But I couldn't tell you because I just don't know. Oh, it's mildly acidic, about 2 to 3 pH. Yeah, that's really acidic. Like 2 to 3 pH for skin, that's pretty intense. So I'm not.
Thank you very much for answering that question.
The info. I think in general, if you ever listen to me talk about anything, you'll know that I am not a huge acid fan. I don't think that they impart any long-lasting helpfulness to skin, though people like the way that they make your skin look temporarily, because by just removing the top layer of the skin, it can make everything look a bit smoother. But I don't think there's any major benefit. However, if you like it and it's not bothering your skin, then it's fine to use it.
It kind of makes it feel taut.
Yeah, but that's not a feeling that I really love. Because if you feel tight, I tend to tell patients I don't want them to feel like that.
Okay. That is the other thing that I used to use on my skin. So I would do apple cider vinegar and then I would use coconut oil.
It's like a salad.
I'm a salad. No, I used to be a salad before I met you.
Yeah, before I met. Well, I mean, coconut oil is fine. Any oil like that is not a problem on oily or dry skin. It doesn't really matter. If you like it, that's not a problem. It doesn't make skin any more or less oily, like as in it doesn't stimulate oil secretion. So people think that coconut oil has like antiseptic properties. I'm not sure if that's entirely useful. I think there's much better moisturizers that you could be using if you need a moisturizer. Hopefully they're organic, yeah, but that's up to you. Egg white and honey is a nice feeling. Yeah, again, I'm not a huge fan of like tightness in the skin because that usually means that you've really removed all your superficial like surface oils and you kind of need oil. But because the whole idea that your skin should be matte, when everyone wants their skin to be like matte, as in not shiny. Do you know what I mean? That's so weird because everyone's skin should have a little bit of oiliness to it because that's normal for skin. That's healthy skin. So having your skin be totally matte is actually really unnatural. It's like people don't want to be shiny, but they want to be glowy. Do you know what I mean?
Yes.
Paradox.
Yes. Yeah, and especially if you've got light shining at you, the oily thing is not so great because you're reflecting. Right.
But I get it, like on camera, like when you do your photo shoots and stuff, I get that. Well, they'll go back and they'll touch it up so you're not shiny, right? So when you're doing, I've never done a photo shoot before, but I would imagine that they try to get you to not be shiny and then they correct it, look dewy. But in the normal world, like in non-photo video world, I think that having slightly like oily skin is normal. I think in terms of just what I would tell an adult as well, like what should be their skincare regime. I mean, I don't think that a child needs just like an adult doesn't need a skincare regime unless there's something wrong with their skin. So I wouldn't say that every 13-year-old needs to have a 3-step skincare thing at night to help maintain their skin's like healthiness. I think that's not totally recommended. I remember when I was like 16 or maybe 14, I thought I needed a skincare routine because I was starting to have oily skin and a little bit of acne. So my first ever skincare routine was the 3-step Clinique skincare routine.
Wow.
Yeah, with the bar of soap and then in the green box and then the purple toner and then the yellow moisturizer. I know. And they still sell all those products now. And whenever I walk by a Clinique counter or whatever, I'm always like, oh my God, I can't believe I used that on my skin because it was just so, the soap and that alcohol-based toner, they made my skin feel very tight after washing. Yeah. And which I thought was a good thing, but it just was not a good thing. So, but my parents didn't really know much about skincare, so they didn't encourage.
No, I mean, we didn't. I don't even remember starting to use anything on my face. And if I did, I probably went to Boots and picked up the first thing, which was not Clinique, but the first thing that the salesperson came along and sold me, which is probably a Boots own product.
Yeah, I mean, I remember using like Clean and Clear. I had acne and oily skin. I just wanted it to go away when I was.
That's marketing is good. I'm an advertiser. Well, before I met you, I was an advertiser straight. Now I'm straight on to you. Should I buy that? And you say no. Don't be so
No.
So somebody's wanted to know: would you do a phone consultation for a 16-year-old?
Yes, as long as in the UK, a 16-year-old is an adult, and Dubai, it's 18. So usually I'd want a parent present if we're in the UK for a 16-year-old, but it's not legally required. But in Dubai, I need to have.
She's in Sharjah.
Yeah. Oh, yeah. That's fine. Yeah. So I would have to have you present as an adult there. So if you contact King's College Hospital, they can arrange that for you. But you would have to be present on the call because a 16-year-old.
Right. King's College Hospital, having had a tele-consultation with Dr. Ali there, I was very impressed with the service. It worked very well.
Yeah, it does work. It works. Yeah, I've done a couple this morning. It works quite well. So it's good. Okay.
Just going back to somebody's suggesting, Nikki is suggesting natural products. If you're going to start your child on a cream, or your child says, I want a moisturizer and a cleanser and what have you, could they just go and buy some homeopathic? Are you safer using something homeopathic?
No, not really. Those natural products all are the same really as synthetic, because the opposite of natural in skincare is synthetic. Most things are synthetic anyway. So the difference really is, like, if you're looking at a natural product, it'll most likely be based on like food-based type oils or essential oils, which are like plant-derived or natural. Synthetic things are going to be anything that's paraffin or petroleum-based, because it's made from petroleum, which is not a bad thing. That's absolutely fine. So, but there is no. I would probably suggest that something that's synthetic is going to be probably better in terms of what it's meant to do, because the natural oils are unrefined. And so they do a whole bunch of other stuff as well. So there are mixes of different types of molecules, as opposed to something that's synthetic and refined where we know it's going to just do one thing. But this is very much like people have this debate all the time. So I might not get into that. But I think if you're a teenager or young child or whatever, and if their skin is totally normal, but they just think that, I want to start using skincare because it looks fun, then pretty much just get them anything. This sounds horrible, but get them anything they want within reason, like within cost reason, because if they have normal skin, nothing is going to be necessarily bad. If you get what I mean, nothing's going to do anything good either, but it's not going to be bad. Does that make sense?
Without perfumes, don't you think the fewer perfumes, the better?
Well, it's only a problem. Fragrance is only a problem if you have an allergy to fragrance. So if you don't have an allergy to fragrance, then you can use fragrance products. I can use fragrance skincare because I don't have any allergies. You're not going to necessarily develop an allergy by using a fragrance product. But if this is totally personal preference. If it's a normal skin child who doesn't have skin disease and they want to start using skincare, then whatever they want to use. I've always thought to avoid fragrance and alcohol. Well, no. So with fragrance, again, it's if you're allergic to it, then obviously avoid using fragrances. But if you don't have an allergy, then you can use whatever you want. Alcohol in skincare, it generally is in there as a fragrance. So benzyl alcohol is an aromatic alcohol, so it's a fragrance, or it's in there as a preservative. So it's not necessarily a bad thing in your moisturizer or whatever, because it's almost certainly going to be in there as like a preservative. Thing is, it's also difficult for you to know because so many fatty alcohols like lanolin alcohol, cetyl alcohol are real alcohols, but the word alcohol is on the label. So then it gets all confusing. So I wouldn't really worry about it. Oh, no one's allergic to alcohol.
I'm going to try answering this question for you because I think I've heard you say it before. What's the solution to back acne for a teenager? Stop eating junk doesn't seem to work for them. I think you'll say that food doesn't have anything to do with it.
Correct. So, yay! She's just, I don't need to be here. So, yeah, that's very correct. Yeah, stop eating junk doesn't seem to work. That's because, first of all, they probably won't stop eating junk, but also there is very weak evidence to suggest that there is a connection between food and acne. I wouldn't necessarily try to change their diets if they have bad back acne. I would just try to treat the acne because it's not going to be diet related. Though generally speaking, eating crap is bad for you, like your health.
But not necessarily bad for your skin.
Exactly. Correct.
So if I have been eating a lot more chocolate over
Have you?
I have. I've stopped now, as of 3 days ago. But chocolate does not give you spots.
No. Nope, definitely not.
I love that.
Good.
Back acne, again, would you use one of those medicated washes?
Yeah, you can try with that. You can start with that. Probably it's not going to give you enough treatment because the contact time isn't going to be high enough to get that to get that like drug into the pore, or into the hair follicle. So I would probably suggest using a topical, I would start with a 5 or 10% benzoyl peroxide, apply it once or twice the entire back. That'll be a place to start. Oral antibiotics can be extremely helpful for body acne.
Would that be a long-term antibiotic?
No, not necessarily. Usually 3 to 6 month course. If the acne clears, then you can stop taking it at that point. But if you have clearance from the antibiotic and it's working for you, there's no harm in continuing it until it stops working. So when it stops working, then you just stop taking it. That's usually how I approach antibiotic use for acne. I've been to a few derms, developed severe acne pre-post menopause. I made it worse. Some topical spray made it worse. Would recommend Accutane. Thoughts? Well, not knowing you at all, I can't really give any specific medical advice, but Accutane is not associated with immune problems, so that shouldn't be an issue with regards to going on it. So I would just ask more questions about Accutane so that you get a full picture of how it works and if it's right for you. So I can't give you any more specific advice than that, though. Accutane is extremely beneficial when used correctly.
But also, seeing it, which is one of the reasons I came to see you in the first place, was that I was getting spots which were due to menopause, which is something that isn't discussed. It's another period of your life, like being a teenager, that your body is changing, all the hormones, etc. And so seeing somebody like you means you can nip it in the bud and sort it out. But just make sure. Now tell me again, you are a dermatologist.
Yes. I am.
But you're say again what the ruling is with your title.
Oh, the title. Okay, so dermatologist. The word or the title. It's not a protected title. So anyone, literally, Caroline, you could call yourself a dermatologist, and there's no legal.
I will by the time we finish these lives.
Yeah, seriously. So anyone can call themselves a dermatologist. Any doctor could call themselves a dermatologist. But the differentiator is if that person is called a consultant dermatologist. So in order to really have a consultant in any specialty, in the UK at least, you have to be on the specialist register and have done specialty training in that field. So if you see someone who calls themselves a dermatology doctor or a cosmetic dermatologist or anything along that line, they're almost certainly not a consultant. So it's worth, in the UK at least, checking on the GMC register and seeing whether the person you're seeing is an actual legitimate skin specialist dermatologist, as opposed to just using the title. It's so funny though, because like speech and language therapist is a protected title.
Oh,
I know.
wow.
Okay. And it's interesting too, because no one who's not a cardiologist, for example, is going to walk around calling themselves a cardiologist, because that would be insane. But cardiologist is not a protected title. So, but with dermatology, it's like everyone. Beauticians call themselves dermatologists, so it's a little bit annoying.
That's true.
That's
true. Myth or fact, doctor, stress causes acne?
That's actually complicated. Stress can cause acne. That's the simple, Nita, that's the simple answer. It's a little more complex than that, but pretty much that's the simple answer. She's going to try and save the life. And the 16-year-old GP says, I can't, Adele Alma, without knowing anything about your daughter, I can't advise you specifically. She would need to go on the contraceptive pill anyway to go on Accutane. So, and it's not harmful to do so unless contraindicated in your daughter to go on the pill. So it is worth trying if you haven't already done so. But it's more. I can't really answer that directly without without like knowing you.
How do people contact you? Through, if you're in Dubai, King's College Hospital, and if you're in England,
you can call London Medical, or you can just send me a DM and I'll tell you how, because it's also linked on my page. If you have any trouble reaching them, then I think that's my Amazon delivery. If you have any trouble reaching them, you know.
Thank you so much.
Bye, guys.
Bye.
Bye.
Everybody, thank
Yes,
you very much. I really will do my best to save this live. Dr. Natalia is full of the best information. Have a wonderful day, and I will talk to you again soon. If there's anything, I'm getting lots of fuss from one of my dogs. If there's anything you would like me to find out for you, then DM me. If you want me to speak to any particular doctor about anything that you want to know about, I will do my best also to help you. So again, have a wonderful day and speak to you soon. Bye.